Penn State Health Hampton Medical Center is one of a kind in Cumberland County. The team uses the latest technology to treat patients. The Monarch robotic assisted bronchoscopy is the latest tool.
It's a robotic bronchoscope. Basically it's human controlled, but it has robotic arms for really good precision and for the ability to really detect fine movements and move smoothly throughout the lung.
Dr. Christopher Schaefer shows us how the high-tech equipment works.
It's controlled by a controller. It almost looks like a video game controller that controls the robotic arms, and through your own input using that controller is how you control the camera to go down through the breathing tube and out into the lungs, and you're able to get out to the target.
The pathway to the target or suspicious area is mapped out for the doctors.
We create a GPS program based on the patient's CAT scan, so we know exactly where to go, which turn to make. It is very similar to GPS type of technology, but there's a lot of different tools and features on the camera that allows us to make sure that we're going to the right spot. It tells us where to turn, take this angle.
The team has used the Monarch system since May, and there is one goal.
We want to be able to get to the small targets that are out there that might be farther out, that are easier to treat, easier to take care of, easier to cure, and we want to find them early. The goal ultimately is trying to cure as many people of lung cancer as we can, and trying to do it in the safest way possible and the best experience and the least complications.
Certainly great news for patients. The procedure takes between 1 to 2 hours. And joining us now is Dr. Christopher Schaefer, pulmonologist at Penn State Health Hampton Medical Center. This technology is truly amazing. Why don't you talk to us about really how it benefits patients?
Yeah, it is great. It's able to allow us to get farther out into the lungs for smaller spots than we otherwise would have been able to go after. It's really allowing us to do more cases bronchoscopically to get a diagnosis, to do the biopsies. And we prefer to do them bronchoscopically to help minimize complications like pneumothorax, which are more likely with the other non-bronchoscopic versions of biopsies. Also, in terms of doing them bronchoscopically, that allows us to sample the lymph nodes as well as the primary spot that we're going after. So it kind of allows for some one-stop shopping to get all those answers all in one procedure, as opposed to having the person undergo multiple procedures to get that information.